It seems that the government of India and the World Health Organization are at loggerheads over COVID-19 deaths during the 2 years of 2020 and 2021. On 5th May, the WHO published a report detailing the excess deaths from COVID-19 worldwide. This report noted that COVID-19 had claimed 15 million lives in these 2 years. The report also noted that over 80% of the 15 million excess deaths happened in just 10 countries, of which India had the largest share. So why are the Indian government and the WHO agreeing to disagree with each other? The WHO report claims that India's death toll was 10 times what the Indian government has acknowledged as COVID-19 deaths. Officially, India maintains that only about 500,000 of its citizens died of COVID-19 in these 2 years. But the WHO report that uses simulations and models claim that the deaths in India could be as high as 4.74 million. Does this mean that 1 out of every 3 deaths reported globally came from India?
That the estimates that they've come out with are within the range of estimates that have already been published or are in kind of technical documents from a number of different research groups. So although perhaps it's slightly towards the higher side of that range, it is very much within the range of what I would say are plausible figures for pandemic excess mortality in India. In some sense, I don't think there is very much of a controversy, not for anybody who's familiar with the literature on pandemic mortality. And of course, this literature actually is based on a number of different data sources. It's based on civil registration data. It's based on data from a number of different surveys. It's based on data from other government systems, like the kind of health management information system. So, and all the data is quite consistent that, India has seen this very high pandemic mortality. So, although I can't really comment on the WHO's methodology in particular, as far as I understand it, they have actually used the same data. In fact, I think their estimates are based largely on civil registration data. And having looked at this data quite carefully myself, I would say that the estimates are actually very plausible estimates.
There have been studies done in the past, especially after the second wave in 2021, where models were used to calculate the COVID-19 deaths in India. One such modeling study was done together by the Center for Global Health Research, IIM Ahmedabad, Sea-Water, Development Data Lab, and Dartmouth College found that the number of dead during the first and the second wave may have been 6 to 7 times higher than what the government was reporting. As many as 3.2 million people may have succumbed to the pandemic between June 2020 and July 2021, the study found. This was in stark contrast to the government-released figures of 419,000 deaths. The reason for such a huge mismatch, the authors of the study note, was because of incomplete certification of COVID deaths, misattribution to chronic diseases, and because most deaths occurred in rural areas, often without medical attention. According to the WHO's calculations, 8.3 lakh Indians died of COVID-19 in 2020, against the official toll of 1.49 lakh. Total deaths reported in 2020 were 81.2 lakh. The overall data coincides with trends observed over the last decade. But if COVID-19 deaths were 8.3 lakh, then non-COVID deaths in 2020 were only 73 lakh. India's total death toll has never been below 80 lakh since 2007. The government also claims that death registration in India has been growing since 2017, when about 79% of the total deaths were registered in India, which according to the government went up to 99.5% in 2020. While the WHO has not budged from its position on the report of the excess death, the government of India has come out with a strong rebuttal. India strongly objects to the use of mathematical models for projecting excess mortality estimates in view of the availability of authentic data, a statement by the government said. Despite India's objection to the process, methodology, and outcome of this modeling exercise, WHO has released the excess mortality estimates without adequately addressing India's concerns, it added. India has also informed WHO that in view of the availability of authentic data published through the civil registration system by the Registrar General of India, mathematical models should not be used for projecting excess mortality numbers for India.